So this is Bob. He's had right shoulder pain for how long now?
About 2 years.
Okay, and tell me a little bit about your story here.
All right, well, it's kind of complex. I am a retired, live in a 55 community, do very little home, got a lot of time. So I have been bowling for about 30 years or maybe even longer. And I've carried a 200 average for 18 consecutive years. I bowled in South Jersey. And about 2 years ago, I started experiencing shoulder pain. So I was very, very fortunate. I live in the Vineland area. Premier Orthopedic has been a doctor, myself and my wife, for a number of years. We've had a number of procedures done there. We've always been happy. Referred me to Dr. Eisenberg, who I was so happy to find a doctor of his caliber to review my MRIs from 1 year to the current MRI and showed me the complete damage that had occurred within that past year. He took time to explain the entire procedure with me as to what he would repair. Surgery was completed last Thursday. I woke up Sunday morning, unbelievably, with zero pain. It was not even a 1. The pain was completely gone, and I was astonished.
Bob, I'm going to interrupt you for just 1 second. So Bob had a rotator cuff repair and a biceps tenodesis. Correct me if I'm wrong. At some point you mentioned that one of the doctors recommended a reverse shoulder replacement for you, right? And I know we talked about the fact that you're a bowler and the significant weight restrictions for a reverse shoulder replacement.
I couldn't bowl anymore.
You'd never be able to bowl again. So it's important to, in my opinion, take every patient in their unique situation, what they like to do in life, and get them back to what they want to do. So in Bob's situation, a reverse shoulder would have done well as far as improving his pain and negating the fact that he had a rotator cuff tear, but he'd never be able to bowl again, which is a lot of what he likes to do. I'm really happy that we went along with the minimally invasive. You could see the little poke holes on his shoulder, rotator cuff repair, rather than a big open surgery. You're pretty early, obviously, only 6 days out. Nothing to get too excited about. There'll be some soreness with physical therapy, even though you're feeling pretty good now. But hopefully long term, once we get your rotator cuff healed and you feel hopefully better, get you back to bowling sometime soon, okay?
Mm-hmm.
All right.
So I think I would conclude by saying if anybody needs any type of shoulder surgery, Dr. Eisenberg is the man. I would put my full faith in the service he provided. And like I said, I know it was a lot of work done. I'm pain-free in 2 days, and I know he will have me back on the bowling alley sometime much sooner than I would anticipate. But with my age, I'm going to make sure that I'm not 100%. I want to be like 125%, because I don't want to have to go back to surgery again based on my age. So once again, if you need a shoulder surgery, if you have any problems there, Dr. Eisenberg is the doctor you need to see. Thank you.